who's the market? The market are hospitals, market are healthcare providers, and they don't want incineration. They want a way to treat their waste without creating other problems.
There are quite a lot of commercially available alternatives to incineration today.
Contractually, everything else ought to go through a non-incineration technology.
Disposing of medical waste can be a costly proposition. As a disposal option, incineration is steeped in controversy, and many hospitals are moving away from it. But why is incineration harmful? And what will it take to move away from this polluting technology entirely? Medical waste disposal is not only an issue of cost and convenience, it also holds potential for liability and for public relations disasters.
Despite the best efforts of lawyers, engineers, and providers, it's really been wishful thinking that we could regulate away the harmful effects of incineration.
The assumption is that you have the pollution control technologies removing these pollutants from the air, but during bypass conditions they actually could bypass those pollution control equipment. And often these happens during the transient parts of the operation, especially shortly after waste is fed, for example.
I know that dioxins come out of the incinerator, and I know that mercury as well is a problem. Not knowing all the effects of that, but just in reading and the many problems that those things cause, I'm concerned.
They had the streams of smoke coming up early in the mornings or late at night.
The bottom line for incinerator communities is that there's mounting scientific evidence to back up their concerns about emissions.
In epidemiological studies that have been done in the last decade and a half, we have seen how people living closer and closer to incinerators have a significantly higher risk of different types of cancers.
The realization that any incineration is likely to lead to pollution makes incineration unacceptable and has led to increasing efforts by host communities to close incinerators. Do healthcare providers have any real choice other than to burn their infectious waste?
There are quite a lot of commercially available alternatives to incineration today. They range anywhere from the standard autoclaves that have been used for many, many decades now, to more advanced type autoclaves which have been specifically designed for medical waste, but they include things like internal shredding, for example, in a sealed container. There are also microwave systems that have been used now for a number of decades.
When Healthcare Without Harm started, there were approximately 6,000 medical waste incinerators in the United States, and now the best estimate is that there are around 110. That's a remarkable success, and it comes really from many healthcare institutions figuring out that instead of paying more money to upfit their incinerator, they could spend less money reducing their waste stream, saving money by recycling and reusing, and then disposing of the waste that was left without creating the problem of dioxin and mercury in the environment by using alternatives to incineration.
As hospitals move towards non-incineration alternatives, they need to bear in mind that there are some options offered in the marketplace that go by other names, but have the very same problems as incineration. The waste industry is now promoting new incineration-like technologies such as pyrolysis, gasification, and plasma arc. These technologies heat the waste and then typically incinerate the waste gases. How can hospitals move to zero burn for the entire medical waste management system? It's already begun. For starters, healthcare institutions are discovering that by more effectively separating wastes, they can save money. When you find ways to stop using costly regulated disposal systems for a big portion of your waste, you stop throwing away money. Institutions have found they've been wasting thousands, and in some cases, even millions of dollars.
There are lots of different kinds of waste in hospital waste streams. Most of it is completely innocuous, and our job is to make sure that that waste is segregated in a way that allows us to maximize landfill diversion through recycling programs, for example. Proper segregation also means that the waste that needs to be treated in any way, whether it's medical waste, hazardous waste, radioactive waste, that we're able to have it in a separate place where we can provide and execute that treatment.
Even after minimization and segregation, there are still regulated waste that have to be treated.
This leaves a set of issues on treatment strategies. Should we use on-site or off-site treatment? What about state rules that require incineration? How can hospitals combine their purchasing power to minimize incineration? On-site treatment is the preference of many providers because it reduces both waste transportation costs and its potential liabilities. Brigham and Women's Hospital in Boston has chosen to install its own autoclaves on-site.
We spent a considerable amount of time and research in deciding upon an autoclave as the most environmentally friendly and the simplest solution.
Catholic Health East, with 33 acute care hospitals and facilities from Maine to Florida, is also encouraging on-site non-burn options throughout its network.
We have some facilities that actually have medical waste incinerators, and we're encouraging them to look at alternative waste treatment mechanisms that they can still have on site, because having contracting with a contractor to take it off site is more cost prohibitive than doing it locally on site.
Only a handful of states still demand treatment of a portion of pathological waste in incinerators. Right now, a lot of waste gets incinerated that neither legally nor technically requires incineration. For example, even anatomical waste can be treated with non-burn technologies, which can be combined with grinding processes to render the treated waste unrecognizable.
Healthcare Without Harm is working to document the availability of the alternatives, and we're working with state regulators to allow those alternatives to be deployed.
Hospitals are finding that when they must send waste off-site, they can use their purchasing power effectively to minimize the use of incineration.
With our waste haulers and the treatment companies who have both incineration and non-incineration technology, is to make it clear that we only want them to incinerate the waste that, from a regulatory requirement, has to be incinerated. Contractually, everything else ought to go through a non-incineration technology.
At Healthcare Without Harm, we developed a model contract. Through the model contract, healthcare providers can demand that medical waste treatment companies eliminate the use of incineration whenever feasible.
As healthcare providers, we can take waste management matters into our own hands by segregation and minimization, by adopting safer on-site alternatives, by demanding non-burn off-site contracts, and by pressing for state solutions that allow full commercialization of non-burn alternatives. It's about time that we do that. Contact Healthcare Without Harm to join with other healthcare providers leading the way to environmentally sound solutions to waste disposal.